I would like to talk to you today about the impact of the National Autism Trainer Programme on professionals and the reported actions that have had impact on autistic patients. Shifting the lens from a deficit medical model to an autistic informed lens has changed how professionals view the autistic people they work with, and importantly, they've shared with us how this has led to changes in how they provide care. This is a first good step towards services that aim to become neuro inclusive and accommodate those with identified, diagnosed, or undiagnosed neurodivergencies. A professional shared how, for the first time, they could appreciate the impact of the loss of a focused interest on the mental health of a young person. Their learning through the programme enabled a greater capacity for empathy for the person's distress. They talked to the young person about monotropism, offering them a non pathologizing way to understand their experience and a way to consider autistic well being going forwards. Importantly, many professionals who become part of the National Autism Trainer Programme work groups have learned how to create recovery plans that include the young person's ideas on the best ways to access their focused interests to prevent autistic burnout. Another professional shared how developing a new understanding of sensory processing, regulation, overload, and autistic meltdowns had been a revelation for them. With this new understanding, they identified the need in their service to foster non judgmental, non blaming, compassionate support for autistic people experiencing a meltdown. Some professionals have noted that this knowledge has led to working groups that support their staff to audit for low arousal environments, and in some cases, it has successfully prevented restraint practices or fear reactions from staff, which may lead to an escalation of distress reactions. Affirming language enables humanizing practice. NHS delegates who are trained with us become more sensitive to language that communicates impairment and otherness in reports, criteria, and referral forms. A professional stated how they had realised that the language used in their service invalidated and stigmatised autistic people, so they prioritised this for immediate change. They started to develop a pre appointment strengths and needs document for the individual to ensure a better first meeting. They changed their deficit based referral forms. They challenged the use of shorthand, subjective, and pathologizing terms such as complex and burden, and committed to describing people's needs and barriers instead. A few professionals have started discussing on how their website can offer information about autism co-created with experts by experience from different cultural backgrounds. A key message of the programme is that we should plan for how we will be in a crisis rather than planning to control the behaviour of someone else. We saw the transformational power of this when one participant shared about making a decision to change how they responded in a crisis. Instead of rushing into a highly charged situation where restraint and seclusion were likely, the professional shared that for the first time they felt confident to slow down, to remain calm. They didn't feel afraid or apprehensive. They were in control of themselves. And in slowing down, everyone there slowed down too, and the situation calmed. Further harm was prevented. The leadership and model of one professional who decided to act differently for the first time provoked much reflection in their team about the possibility of working differently. Becoming aware of the double empathy problem in therapy enabled one professional to gain a new understanding of an autistic client's response to therapy. The clinician had previously viewed their "I don't want to do that" response as a lack of engagement or a lack of motivation. However, they hadn't explored the reasons behind this statement with the person. The training provoked them to be more curious about the barriers and challenges and to address communication differences. So they went back and they started to ask different questions. What will it be like for you to discuss these difficult experiences? How can we do that safely for you? What will make it easier? What would you feel comfortable to share with me now? Another question a clinician asked for the first time was, "What can we do to make you feel comfortable here?" The professional explained how the direct, detailed, and honest answer from their client was unexpected and a little uncomfortable for them. However, this created a significant shifting in the power dynamic and was an experience of epistemic humility for the clinician. The simplest and most important question that emerged in conversations was, what do you need, and how can we make that happen for you? The experience-sensitive approach calls us to ensure we are enabling the person's agency throughout the therapy journey. Agency is enabled through humanising interactions and care, and at the other end is passivity. Power over strategies and compliance approaches are at the root of dehumanising care. These conversations provoked one participant to rethink the care of a patient with an eating disorder. They described the team's view of the person as controlling, and it had been decided by the team that the person could not have any control in their own recovery. The realization that a rigid and controlling power over approach was likely blocking this person's recovery provoked the professional to go back to their team and reconsider their approach. The challenge of not having enough time, juxtaposed with the importance of taking time to work well with an autistic person, has been a perpetual conversation and concern for participants. The comment here was shared by a professional who reflected on providing care that isn't worked out with the person, or isn't aligned with their needs, or isn't meaningful for them, can be poor use of time for all. We're wasting their time and our time. Regarding the challenge of working in systems where care is prescribed into minutes and numbers of sessions, staff shared that they felt more empowered to advocate for flexibility. Affording time is a reasonable adjustment for autistic people. We've met passionate NHS professionals leading the way in neurodivergent affirming care in their services who are pleased to be part of a movement of changing practice. Knowing they are not alone brings them hope. Those who attend additional events and receive one-to-one support also mention that they don't feel alone in this anymore, and their motivation for change is sustained even when change is happening slowly in their service. Participants have shared that being part of the training has helped them feel more supported and cared for, and on difficult days, they've said they feel less helpless. Commonly, professionals say they're excited about the potential to effect change, and one participant described it as being droplets of motion in a wave of change.